Okay, yes, Divya. So I think it's exactly 6 o'clock. All right.
Yes, sir.
So good evening, everyone who's joined us in from different parts of the country. Welcome everyone to PhD 101, which is Public Health Dentistry 101's Rapid Revision webinar series. Now, this is an ongoing series for over a year now, which has been reaching out to students from across the country from various colleges. The most unique part of our platform is you get to learn from a new educator every week, happens to be faculty from different colleges. So, in connection with that, again, it gives me immense pleasure to welcome our speaker for today, which is Dr. Divya Raghunathan.
Thank you,
Now, a
sir.
little bit of introduction about Divya for our audience here. Dr. Divya Raghunathan, presently working as assistant professor in the Department of Public Health Dentistry, and she is working at Meenakshi Ammal Dental College, Tamil Nadu. Background information again, Divya again known to be working in various arenas and fields. So let me just keep this really interesting for all of you all. Now, Divya completed her BDS and MDS, and MDS in Public Health Dentistry in the year 2019. And she's presented, of course, various papers and posters and conferences and has won numerous accolades for that. A special mention of Divya actually receiving the patent for Dentaid, which is a mobile-based application. Also been given the first prize in the Mannequin Challenge at our 22nd National IPHT conference. Also first prize in Tabletop Puppet Show at the 11th National PG Convention of IPHT, which was hosted by the IJIDS Pondicherry. And second prize in the quiz competition and best paper presentations and so on and so forth. And her core skills revolve around working in research methodology, biostatistics, and problem solving skills. In case if you're looking for assistance in that direction, definitely this is the person to go to. She continues to work at Meenakshi Ammal Dental College as an capacity of an assistant professor. She also has a tremendous amount of experience in the clinical setting and outreach activities, and also is experienced in counseling patients on preventive care and positive lifestyle changes. So I think it's really an honor for us that we've had someone as young as Divya, who is eager to take public and dentistry in her own dimension to greater levels. So thank you so much, Dr. Divya, for coming across and doing the session for us today. And I'm sure the students would really enjoy the topic which we'll be dealing for us is dental manpower. Now, context into the topic for today is dental manpower, extremely important, again, not just from the exam point of view, but this will be examining the various types of functioning in a dental system, be it from the operating, non-operating auxiliaries, and it could be the oral health workforce. Now, when we discuss this in detail in public health dentistry for third year and final year BDS students, you must understand that various systems have been evolved across the country according to the economic and the political system and the social structure. So there have been different names and different synonyms which I used. So you need to know the various types of auxiliaries. You need to know a lot of questions which emanate from this topic. And again, it's also a favorite among in the entrance examinations. So I think we have Dr. Divya who will do justice to this topic. And with this background information, I welcome Divya again to our panel and all the lovely students who are eager to hear from Divya. Yes, over to you, Divya.
Thank you so much, sir, for the wonderful information. Thank you so much. Uh, can we begin, sir?
Yes, please. Yes.
Yeah. Just a second. So, very warm welcome to one and all gathered here. As sir had already told, I'm Dr. Divya, Assistant Professor from Public Health Dentistry, Meenakshi Ammal Dental College in Hospital, Chennai. So today's topic is about dental manpower. As sir had already told, it's an important topic not only from the from your exam point of view, but also we have to know what exactly is dental manpower and who are the our subordinates or who are the other dental assistants who are actually there, but we are unaware of them. So the contents will revolve around introduction, the difference between basically a difference between dentist and a dental auxiliary, the classification of dental auxiliaries, which is given by WHO, frontier auxiliaries, new auxiliary types, degrees of supervision of auxiliaries, and conclusion. So we'll begin with, so generally any vision of a dental team is one where the people with different roles, different experience, different function and period of training will work together to treat patients to treat the patients. Okay, so thus any dental care doesn't depend only upon the available infrastructure or any resources, but it also depends upon the availability of skilled human resources or skilled human team. Okay, and in this context, we are going to discuss about dental auxiliaries. So before moving on into the actual topic, I'll just give you a brief difference between who a dentist is and who a dental auxiliary is. Okay, so dentists are those who are licensed to practice dentistry. They are legally entitled to treat patients independently, and they are qualified with a dental degree, and they are more concerned with the prevention and control of dental diseases. But whereas in a dental auxiliary, they are not qualified with a dental degree, and they'll be given responsibility by the dentist in dentist, and to and the importance of dental auxiliary is they'll render help for dentists and to care the patients. Okay, they'll be given responsibility by the chief dentist, and then in turn they'll be rendering care to the patients. Okay, or else the duty will be assigned by the dentist at dental auxiliary, and then they'll be doing the treatment for the patient. Directly, they are not qualified with a dental degree. So as we already told, they are given responsibility by a dentist so that they can help render dental care, but who himself or herself is personally not qualified with the dental degree. So duties will vary from sorting out your instruments to relatively complex procedures, which forms the main part of the treatment of the patients. Okay. So this person is called as the dental auxiliary, who helps us with taking the instruments and giving, and helping us in all sorts of things. So classification as given by the WHO in the year of 1967, they had given under two important terminologies, that is the non-operating auxiliaries and the operating auxiliaries. So as far as non-operating auxiliaries are concerned, they've again subdivided it into clinical and laboratory auxiliaries. So clinical non-operating auxiliaries are those who assist the dentist clinically, but individually doesn't carry procedures in the oral cavity. They don't directly treat the patients, but they just assist the dentist clinically. Okay, and laboratory auxiliaries are those who does all your lab procedures. That is the extraoral, intraoral appliances, your models, and all those things. So lab people are different and clinical people are different. Okay, so this is about the non-operating auxiliaries. And operating auxiliaries are those where they carry out certain treatment procedure for the patient under the supervision of the professional. Only after the professional gives a green sign, they'll be performing the procedures for the patient, but they'll be under supervised by the chief dentist. So this is the basic difference between a non-operating auxiliary and an operating auxiliary. But this classification was again revised, and it was given in a concise format. Okay, the same subheadings only, that is the non-operating auxiliary and the operating auxiliary, but they've given along with the designations. Okay, so non-operating auxiliaries, under that we have four important titles, that is the dental surgery assistant, the dental secretary, otherwise called as the receptionist. The third one is the dental lab technician, and then the fourth one is the dental health educator. So under operating auxiliaries, we have the school dental nurse, the most important question, the dental therapist, the dental hygienist, and again the one of the most important question, the expanded function dental auxiliaries. So we'll be discussing about each person one by one. So first we'll start from the non-operating auxiliary side. So first, as we already discussed, we have the dental surgery assistant. Then we have the dental secretary, otherwise called as the receptionist. Then we have the dental lab technicians, and then the dental health educator. So we'll start from the dental surgery assistant. So the other names, basically, before going on into the actual topic, we'll see what are the other names which are given to the dental surgery assistant. They are otherwise called as dental assistant, chairside dental assistants, and dental nurses. So, but they are not legally permitted to treat the patient independently, as we already told. They won't be legally permitted independently to treat the patient, but they'll carry out work under three criteria. Okay, one is under the supervision of the dentist. The second point is the duties which are prescribed by the dentist, they'll be able to do it on the patient, and the duties prescribed by the dental hygienist, who's ultimately employed by the dentist. Even those duties they can be able to do. Okay, so under only three criteria, under the supervision of the dentist, the duties which are prescribed by the supervising dentist, or the duties which are given by the dental hygienist, who is ultimately employed by the chief dentist. So under these three conditions only, the dental surgery assistant will be working on the patient. So if you see the history of how the dental surgery assistant evolved, it was around 1885 when there was a person called as Dr. C. Edmund Kells of USA. Okay, what he did was, for in his clinic, he hired a woman called as lady of attendance. Okay, why he did this? Because he wanted all the lady patients who come to him for dental treatment to make them feel at ease. Okay, because why? Because if the lady patients are coming, they'll be more comfortable to talk to a lady rather than a male in that time and all. So all the ladies who needed dental treatment were made to feel at ease because of the lady of attendance. So this person who was being hired used to do all the routine household chores, both in the clerical as well as in the operatory side also. So, and parallelly, if you see, it was a time of World War II, and there was also so much of labor shortage because of so much of loss of lives. So what happened was, slowly these helpers utilization started increasing because there was no people to help. These helpers utilization slowly started increasing. Okay, so because of that only, the advent of once again, this thing is not being seen. So that only led to the advent of four-handed sit-down dentistry. Okay, because of the screen, you're not able to see, but in the presentation with Densi sir will be sending you, you'll be able to see. So because of this utilization of, because of this increased utilization of the helpers, the advent of four-handed sit-down dentistry came into existence. So this is how the four-handed dentistry or the dental surgery assistants came into existence. So if you see what the four-handed dentistry is, in short, it is the art of seating both the dentist and the assistant at a comfortable position so that they are within easy limit of the patient's mouth, okay, within the easy reach of the patient's mouth. So during the four-handed dentistry, the patient will be made to sit fully, will be made to be in a full supine position, and the assistant will be handling the dentist, whatever instruments the dentist wants, and she or he'll be performing additional tasks also, like retracting or suction, or putting suction or aspiration kind of techniques and all. The basic advantage of doing this, of adopting four-handed dentistry, is that there'll be less fatigue for both the dentist and the dental assistant, and efficiency of work will also be higher. Okay, there'll be greater efficiency of work as well. So these are the two important advantages of the four-handed dentistry. So the next one is the duties which the dental surgery assistant will be doing is, it ranges very widely. Okay, they receive the patient initially, they prepare for the patient, I mean the preparation of the patient for any treatment he or she needs. They'll keep all the mouthwash napkins ready, sterilization of the instruments, preparation of the instruments for the treatment, and mixing all the restorative materials for both the filling and permanent materials. Then taking care of the patient till they leave, and include, I mean this includes both cleaning the instruments and then preparing the instrument set for the next patient and all. And if there is any surgery happening, they'll even prepare instruments for the surgery thing also. And all the case histories they'll be documenting for filing purposes, and assistance with x-ray work also. They'll process the x-rays, they'll mount the x-rays for easy viewing of for the dentist. Then they'll give post extraction instructions, all your oral hygiene instructions, all these things will be given to the patients. And even aftercare of the patients will be taken for people who have had general anesthesias. So their duties will range widely. Okay, so these are the duties given by the dental assistants. So when you're writing your answer, you can split up and write. If at all dental surgery, I mean dental assistant is asked as a 5-mark note, you can put contents like a brief introduction, history. Then you can say what a four-handed dentistry is. Then the duties prescribed by the, then the duties done by the dental surgery assistant. So in that way, it will be much more proper. Your answer will be much more authenticated if you write like that. Rather than doing it in a paragraph, you can split it up and write it like this. Okay, so this is about the dental surgery assistant. So next, moving on to the dental secretary or receptionist. They are otherwise called as receptionist. And basically, if you see, they have only two duties. Okay, they assist the dentist with the secretarial work, and the patient reception duties will also be done by them. Reception duties in the sense they'll collect all the demographics and keep. Okay, and they'll be telling the dentist that some person has arrived, and they'll be informing all these things. All the secretarial work will be done by the dental secretary or receptionist. So that's all with the dental secretary and receptionist. Moving on to the third non-operating auxiliary, that is the dental lab technicians. So they are otherwise called as dental mechanics. And basically, they'll concentrate on your extraoral appliances, constructions, and repair of oral appliances and bridge works and all the things which a usual dental mechanics will do. So basically, they receive their training through apprenticeship program with a formal training in the dental school or either in a training college, okay, or a technical college. And the course duration is for 2 years. So basic primary duties is they cast the models from the impression and fabrication of your splints, dentures, ortho appliances, and all those things. So these are the main duties what they do. As given by the DCI, there are some course details, okay, for regarding the dental laboratory technician. So what they are saying is that during the course study should definitely extend for a period of 2 academic years, post which you will be rewarded with a dental mechanic certificate. And even during the time of enrollment, the candidate should be at least 15 years of age or within at least 3 months of close to it. And he should be medically fit as well. and the candidate must have at least passed matriculation examination from a recognized university, either taking science as the main subject or some subject equivalent to science. So these are the course details which are given by the DCI. So this is a very easy thing to remember. So even this one, if you write, it will be much more authenticated. And compared to your regular dental lab technicians, there was a term given as denturist. Okay, denturists are people, or denturists are dental lab technicians who are actually permitted to fabricate dentures directly to the patients. Okay, without any chief dentist supervision or without any prescription and all, they'll be able to fabricate directly to the dentures directly to the patients. So they were called as denturists. They may be licensed or registered as well. So how this kind of thing evolved was that the desire for autonomy or the desire for freedom among the dental lab technicians only led to the formation of the denturist. And the craft of doing all these kind of works is called as denturism. So that is how the denturist came into existence. Okay, but ironically, ADA gave one definition for denturism, which stated that fitting and dispensing of dentures illegally to the public. Right, so this was actually given by ADA, and it was surprisingly very, it was not accepted by the people. Okay, but there were 3 states which actually allowed people to undergo, study for this thing. Okay, it was Tasmania, Denmark, and Maine. Tasmania was the first state to legally permit the dental technicians to provide prosthetic service to the people. And Denmark, again, they made denturists prescribe and fit RPD to the patients without any supervision of the dentist. And again, in Maine, they permitted denturists to take impression and fit the dentures, but again, under the directions of the dentist. Okay, even after these 3 states partially accepted for this craft, ADA was still again unhappy. They again moved it to a political level. They vigorously opposed this denturist movement at the political level itself. So wherein there was a committee called as WHO Expert Committee on Auxiliary Dental Personnel. Okay, in 1959 this came. So they have recommended, because of ADA, they have recommended that only qualified dentists should be allowed or may work directly on the patients. Rather than all these people, only qualified dentists are allowed to work on the patients directly. So this is about the dental lab technicians. Moving on to the 4th non-operating auxiliary, that is the dental health educator. This is again a very simple duty which has been adopted by the health educators. That is, they instruct the patients based on the prevention of dental disease. They instruct, or we can also say that they'll educate the people, common people, based on the prevention of dental diseases, or even the brushing techniques they'll be able to give, oral hygiene instructions and all. So they may be also permitted to apply preventive agents intraorally. Okay, Sweden was a place where 2 additional weeks of training will be given to these kind of health educators, where they'll also be able to conduct fluoride mouth rinse programs to a group of school children. So this is about the dental health educator. It's a very small thing only, but just try to remember this also. So with we've already seen about the non-operating auxiliaries. We dealt with 4 important non-operating auxiliaries. The first one was the dental dental assistant. The second one was the, can anyone tell me? Can anyone unmute and tell me what all non-operating auxiliaries did we see? The first one was the dental assistant. The second one was a very easy thing.
Dental secretary.
Yeah, otherwise called as?
Denturist.
Yeah. Sorry?
Denturist.
Denturist.
Yeah.
Dental secretaries are otherwise called as?
Dental receptionist.
Yeah. And the third non-operating auxiliary were?
Dental laboratory. Dental lab.
Then the fourth one was the dental health educator. Okay, so with this in mind, we'll move on. So next is about the operating auxiliaries. Okay, here we have the school dental nurse, the dental therapist, the dental hygienist, and the most importantly, the expanded function dental auxiliaries, otherwise called as EFDA. Okay, we'll see again one by one. So the first set of people are called as the school dental nurses. So here they are permitted to diagnose the dental disease and also plan and carry out certain specified preventive and treatment measures. They'll be able to diagnose the dental disease and also carry out certain preventive and treatment measures. Like example, you can say like treatment of basic level of dental caries and periodontal diseases in school children. Okay. So again, if you move on to the history and see, in 1905, if you see, New Zealand was much more interested to improve the dental conditions of the children, particularly. Why? Because treatment of children wasn't an accepted area of dentistry during that time. So New Zealand was much more interested to improve the dental conditions of the children. So with all this in mind, there was a person called as T.A. Hunter. He was the founder of New Zealand Dental Association and also a pioneer in establishment of dental school in New Zealand. He influenced a scheme called as dental nurse scheme. He just put forth something called as a dental nurse scheme, but it was just kept like a proposal. But only after like 15 years of time only, there was they established this scheme, okay, called as dental nurse scheme. It was established in Wellington in the same New Zealand in 1921. That was also because why? Because due to extensive dental diseases found in the army recruits during World War I. Initially, they didn't accept, but only after 15 years, they came to know that so much of people were affected with dental diseases. That too, particularly the army recruits. Since they need to be physically fit, they put forth something called as the dental nurse scheme. So that's how this came into existence. So if you see all these kind of school, and one more thing, the nurses here who were trained initially were trained in a school called as Dominion Training School for Dental Nurses. This is a very important thing. Maybe they might be asking you for during your Viva session also. So the nurses got trained in a school called as Dominion Training School for Dental Nurses. Okay. So if you see the training for these people were again for 2 years, both reversible and irreversible procedures were taught to them. And once they have completed this 2-year courses, the nurses, each nurse will be employed by the government to a particular school. So in this school, they have to provide regular dental care for around 450 to 700 children. Okay. And basically, it's a general rule. Each school having more than 100 children will be having their own dental clinic. So the regular dental care which will be provided by the school dental nurse will be for a group of 450 to 700 children. Okay. So even if you see in that school, the school dental nurse will be treated equally as a normal teacher only. Okay. Even the salary will be based on the what the teachers receive only. The school dental nurses will also be receiving. The same salary will only be given to both of them. And in New Zealand, the nurses will be expected to provide care for children at every 6-month intervals. Okay, and there is two main important people. One is the dental nurse inspector, and the second is the principal dental officer. Both these people will visit the school twice a year, and they'll be checking how the progress of all these things are going on. Okay, so the dental nurse inspector and the principal dental officer, the head for all the schools, okay, they'll be coming and visiting the schools twice a year, and they'll be checking how the progress is going on. So this is about the thing. And the duties, again, it ranges widely. They do oral examination. The school dental nurses will provide prophylaxis, topical fluoride application. They give advice on dietary fluoride supplements, administration of LAs, cavity preparations and amalgam placement fillings, both for primary and permanent teeth, pulp capping procedures, extraction of primary teeth, and all the individual patient instructions will also be given to them regarding the tooth brushing and oral hygiene, or if there is any simple things to be taught, they'll even teach that to them regarding dental aspect alone. And classroom and parent teacher dental health education will also be given, and referral of the patient. If there is any kind of emergency to the children, they'll even refer the patient to private practitioners for more complex services. Okay, examples are like if there is any extraction to be done for the person, it will be referred. Restoration of any fractured permanent incisors, and if the person needs any orthodontic appliances, they'll be referred to the private practitioners. So additional information is that in Britain, the first school dental nurse models were graduated in the year 1962. Okay, it was in a place called as New Cross area of South London. So all these people who graduated in 1962 were called as New Cross auxiliaries. And they were, but the thing was, they were not trained to work as an independent operator, right? They were called as New Cross auxiliaries because of that place, but they were not trained to work as independent operators. And many other countries actually adopted the use of school dental nurses, like Malaysia, Singapore, Myanmar, South America, Hong Kong, Australia, and all. So even they utilized someone called as the school dental nurse. And one more thing was the Saskatchewan dental nurse. This actually was asked as a frequent 5-mark question in our university. That is Meenakshi University. So we usually give importance to Saskatchewan dental nurse also. So in North America, they actually gave an authority for someone other than the dentist that they can legally drill and fill the teeth. Okay, the nurses here receive 2 months of supervision only. Only for 2 months they'll be supervised, and after the 3rd month they'll work under the much more experienced dental nurse. Okay, so only after 2 months of supervision, from the 3rd month they'll work under an experienced dental nurse. If the performance is good, then they'll work without any supervision of the experienced dental nurse. but always the initial examination of the nurse will be done by the dentist only. Then after that, every week the dentist will come and visit the dental nurse. But apart from that, she'll be working only without any direct supervision, provided her performance is good. Okay, so this is about the Saskatchewan dental nurse. So with all, so that is all for the school dental nurse. So you have a brief introduction, you have a history, then you have who are called as new cross auxiliaries. Then you can talk about Saskatchewan dental nurse. Then you can talk about the duties about them. Right? It will be much more. It will be very much enough for your 10-mark or 5-mark answers. Answers also. So the second one is the dental therapist. So they are the second group of operating auxiliaries. So here they are permitted to carry out certain specified preventive and treatment measures, including the preparation of cavities also and the restoration of teeth, but only under the supervision of the dentist. Everything can be done by the dental therapist, but under the supervision of the dentist only. Okay. So in UK, the dental therapists were uniquely called as the dental dressers from 1979. So here what they do was they work under the local authority as well as the hospital services also. But again, they have to work only under the directions of the dentist. Only after the dentist approves, they can work on the patient. Okay. And this was done in UK. So in UK only they were called as dental dressers. But in Australia, the dental therapists are not allowed to diagnose and plan dental care at all. They are permitted to work based only on the written treatment plans devised by the supervising dentist. Only after the dentist says they will be able to directly touch the patient. So the training generally for any dental therapist is given only given for a period of 2 years. Okay. Here the duties will again duties are very less only, but it's very important as far as dental therapist is concerned. It's very important. They do clinical caries diagnosis. They do cavity preparation in both deciduous and permanent teeth. They do vital pulpotomies under rubber dam in deciduous teeth. Extraction of deciduous teeth under local anesthesia can also be done by the dental therapist. Okay. So the next set of operating auxiliaries is the dental hygienist. They are actually licensed and they are registered to practice dental hygiene under the laws of appropriate state, province, territory, or nation. Again, they'll work only under the supervision of the dentist. Okay, everyone will work under the supervision of dentist only. So as given by the DCI, the definition for dental hygiene, definition for dental hygienist, they are a person who does oral prophylaxis. They give instructions in oral hygiene and preventive dentistry. They assist the dental surgeon in chairside work, and they also manage the office under the supervision of the dental surgeon. So everything will be done only under the supervision of the dental surgeon. Okay. The course details is for a period of 2 years, as the same for other thing also. It's for a period of 2 years, only after which you'll be awarded with a dental hygienist certificate. And the candidate should at least be 15 years of age at the time of admission, or 3 months within it, here plus or minus 3 months of it. And he should be again medically fit. And the same thing, he should be passing at least he should be passed at least from a proper school, a proper college, taking science as the main subject or something equivalent to the science subject. Okay. So again, if you see the history, in 1902 there was a person called as C.M. Wright. He just planned that something called as a subspecialty for dental profession should be there. He was planning for a formation of some subspecialty of dental profession. But this plan was put into action by Dr. Alfred Civilian Phones of Bridgeport, Connecticut. So in 1905, after 3 years, Phones started training a person called as Mrs. Irene Newman in dental prophylaxis. After 1 year, exactly after 1 year, that is in 1906, Mrs. Irene Newman was called as the first dental hygienist, and Dr. Alfred Civilian Phones was called as the father of dental hygiene. Okay. Here, the duties again, it will vary from cleaning of mouths and teeth with particular attention to calculus and stain. They'll give particular importance to, the calculus and stains alone, and application of fluoride, sealants, and other prophylactic solutions. Everything will be done by the dental hygienist. Screening or preliminary examination of patients as individuals or those who are in group, such as school children or industrial employees, so that they can be referred to a patient for further treatment, will also be done by them. And instruction in maintaining the oral hygiene will be given, and even research work in the field of dental health will also be taken up by the dental hygienist. Okay. And apart from all the regular auxiliary thing, there was something called as the independent contractual practice of dental hygiene, where the dental hygienists were allowed to practice dental hygiene independently. So this was in 1976 initially, where Linda Kroll of USA, the first person, she was the first to start independent contractual practice. Okay, she was not associated anywhere. She was independently practicing dental hygiene. And later on, after some, like 15, 20 years, in 1991, in Sweden, all the dental hygienists were allowed to practice dental hygiene independently. So this was called as the independent contractual practice of dental hygiene, right? So moving on to the most important frequently asked question, that is the EFDA's expanded function dental auxiliaries. Okay, so they are dental assistants or dental hygienists in some cases who has received further training and duties related to the direct treatment of patients, though still working under the direct supervision of the dentist. It will be under the supervision of the dentist only, but their duties will be expanded. Okay, they are also called as expanded function dental assistant, expanded function dental hygienist, expanded function auxiliaries, technotherapist. I mean, differently they are called as technotherapist also. Okay, and the duties again it varies widely. That is placing and removing rubber dams, placing and removing temporary restorations, placing and removing matrix bands, condensing and carving your amalgam restorations in previously prepared teeth, and they've even placed the acrylic restorations in previously prepared teeth. They finally they give a final finish and polish the previously listed restorations, and also they make the patient sit, perform initial inspection completely, and all with all the x-rays available, they mount all these things, and then they'll call for the dentist. Okay, basically everything will be done by the FDA. Finally, the dentist will come and examine the patient. They'll perform the diagnosis, they specify a plan for a treatment, and then the dentist gives LA and prepares a group of cavities, insert all pulp protection and cement bases. What the EFDA does is she'll help in the four-handed dentistry, and then she'll finish off the procedure. All the restoration things, she'll finish it off. That is, if the dentist does all the restoration things, she'll be polishing and she'll be finishing the restoration and all. Okay, so that is the duty of an EFDA. So first large-scale service applications of expanded duty principle were made in Philadelphia only, and they were called as technotherapists. Uniquely, they were called as technotherapists. And for this thing, 4 levels of training and qualifications were recognized. Okay, certified dental assistant, preventive dental assistant, dental hygienist, and dental. I'm not able to see that. So the first thing is the certified dental assistant. This training course is for a period of 8 months of duration, and the assistant was taught even the traditional chairside duties as well. And the only intraoral duty the certified dental assistant will be able to do is only exposing the radiographs. Okay, that is the only intraoral duty she'll be able to do. Other than that, they'll be taught all the traditional chairside duties and all. So the next set of things is the preventive dental assistant. Here, the trainee had to be a certified dental assistant, and the full-time courses were for a period of 3 to 6 weeks of length duration. So they are permitted to polish the coronal portion of the teeth without any instrumentation and make impression for the study models. They topically apply all your caries preventive agents. They place and remove rubber dams, and they maintain the patient's oral hygiene as well. The third level is the dental hygienist. A student here has to be a certified preventive dental assistant. They have to be certified, and here the training program is for a period of 8 months. Okay, they are allowed to carry out scaling, preliminary examinations, including all from your case history till your clinical findings. They'll be able to do all the examination, and they'll provide complete prophylaxis, including both scaling and root planing and polishing of the fillings also, and they'll apply some agents also. So the fourth one is the dental hygienist with again expanded duties. It's for a period of 4 months. This was given to dental hygienists who have at least 1 year of practical experience. Okay, they were actually allowed to remove sutures also. They were able to place and finish and polish the restorations of amalgam and resin. The same thing, they place cavity liners, they remove the matrix plan, they place the matrix plan, retract the gingiva, and they also fit all your things, all your dentures and all. Okay. So with that, the operating auxiliaries are over. So what all operating auxiliaries did we see? List out the 4 things. Please unmute, and can anyone tell? The first one was the school dental nurse. The second one was second set of auxiliaries.
Dental therapist.
Yeah. Then the third one are?
Dental hygienist.
Yeah. Then the fourth one?
Expanded
function operating dental auxiliary.
Expanded function dental auxiliaries. Okay. So as far as this thing is concerned, the operating auxiliaries are also over. Then we have a new terminology called as frontier auxiliaries. So here what happens is that Generally, if you see in all the developed countries, the dentists prefer to remain in urban centers or urban setup, and a large number of areas are too distant for the public or the private dental offices for the inhabitants to reach. Okay, people from rural areas find it difficult to come to the urban center every time if they are in need of any emergency, or even for a regular checkup. It becomes very difficult for them. So in these kind of situations, the frontier auxiliaries will help. Okay, so the duties are, they'll be posted there, and the duties ranges from simple dental prophylaxis. Basic dental education can be done by them. Basic dental first aid will be given by them. Even the basic chair repair can be done by them. They organize fluoride rinse programs also. So they are called as the frontier auxiliaries. Okay. So even the expert committee on auxiliary dental personnel of WHO put forth two more new type of dental auxiliaries called as dental licentiate and dental aid. Okay, they are called as the newer type of auxiliaries. One is the dental licentiate and the dental aid. Okay, dental licentiate is a semi-independent operator. Okay, they are semi-independent operator. Have in mind, they are trained again for a period of 2 years. They will be able to perform dental prophylaxis, cavity preparations, extractions under LA. They'll be easily able to recognize any diseases at an early stage itself. Okay, and the treatment of most prevalent diseases supporting tissues of the teeth will also be done by them, and draining of dental abscesses can also be done by them. Okay, a little bit more advanced state. So they are called as dental licentiates. The second set is called as the dental aids. Okay, the elementary first aid procedures for the relief of pain will be done by them, including your tooth extractions under LA, control of hemorrhages, recognition of dental disease at an earlier stage, so that the people will be able to reach the urban center, or they will be enough to justify transportation of the patient to a center where proper dental care is provided, where a proper dentist is posted. So they'll be able to refer them to the clinic also. So these new auxiliaries are particularly useful in some countries having acute dentist. Okay, people who are having people who are not there, even the dentists are not posted in any rural setup, they'll be able to refer to them. And these new auxiliaries are particularly useful in this kind of situations, and that too in some countries. Okay, so after all these things, there should definitely be something called a supervision. We have to see whether these kind of auxiliaries are performing their duties correctly. So degrees of supervision of auxiliaries is again a very important topic. ADA in the year 1975 has defined 4 main types of degrees of supervision, okay, for the auxiliaries, with the assumption that the ultimate responsibility was assumed by the licensed dentist only. If there is any problem to the patient, or if there is any complication, then we'll be in charge of that. So there are 4 main types of supervision. The first is the general supervision. The next is the indirect supervision, direct supervision, and personal supervision. So general, indirect, direct, and personal supervision. Let's see one by one. So general supervision, as the name suggests, the dentist has authorized the procedures, okay, and they are being carried out in accordance with the diagnosis and treatment plan completed by the dentist itself. Generally, he'll supervise how, he'll be authorizing the procedure. Those procedures will be carried out in accordance with the diagnosis and treatment plan only. It will not change. Okay, and the dentist will be supervising the auxiliary generally only. Whatever she's doing, they will be generally supervising that. But on the other hand, in the indirect supervision, the dentist will be seated in the dental office only. He or she will authorize the procedures. They'll be remaining in the dental office only. They won't leave the auxiliaries like that, and they won't go. They'll be in the dental office only. But all the procedures which they have listed will be done by the dental auxiliaries. Okay, so this is called as indirect supervision. The dentist won't be involved in that, but they'll be supervising them indirectly. Whereas in a direct supervision, the dentist will be next to the dental auxiliary, personally diagnoses the condition to be treated. They personally authorize the procedure, and before the dismissal of the patient, they evaluate the complete performance of the dental auxiliary. So this is called as direct supervision. Okay. The last set of supervision is called as the personal supervision, where the dentist is personally involved in operating the patient, and he authorizes the auxiliary to aid the treatment by performing concurrently all the supportive procedures. The dentist will only be doing all the things, but the auxiliaries will be helping the dentist. So this is called as personal supervision. Okay, so the 4 types of supervision, as we already saw, general supervision, indirect supervision, direct, and personal supervision, right? So with all this in mind, I hope it was understandable. So with all this in mind, we'll just conclude. So because of the unique privileges which are granted to the dental auxiliaries, the members of the dental profession, we have the responsibility of providing a higher standard of service to the patients, and they should also assume their duties freely and voluntarily. Okay, we shouldn't just keep the dental assistants aside. Even rather than doing a two-handed dentistry or rather than performing care individually, a four-handed dentistry is much more easier. And even as we already stated, advantages are less fatigue for both for the doctor and for the dental assistant, and even the work efficiency is to a very good level. Okay, there is greater efficiency of work. Okay, so always prefer four-handed dentistry. Just don't think that dental assistants are not a proper set of people and all. They are very much important for us. They are very much essential during performing any kind of treatment also for the patient. So always an assistant is best according to me. Okay. So I've just kept a small quiz session for you guys. So I hope everyone is ready. Either you can unmute and tell, or else you can post it in the chat session also. Okay. It'll be better if you unmute. It'll be like an active participation. Are you guys ready? Can I start projecting the questions? Guys? Okay, the first question is, under the revised classification of dental auxiliaries, school dental nurse will come under what kind of auxiliary? This is under the revised classification, not under WHO classification.
Operating
Sorry? I didn't hear you.
operating auxiliaries.
Yeah. Very good. It is under operating auxiliary. They come under the operating auxiliary. So Dr. C. Edmund Kells of New Orleans hired a lady to serve the lady patients, and that terminology is called as
dental hygienist.
No.
Dental surgery assistant.
No.
The terminology. What is
The
exactly?
terminology.
Come on, guys, you can put in the chat box. Fastest finger first.
Yeah.
Lady of attendance.
No. Not able to see the chats also.
Lady of attendance.
Lady of?
So attendance.
Yeah, very good. It's called as lady of attendance. Then the third one is the dental lab technicians who are permitted to fabricate dentures directly on the patients without a dentist prescription are called as?
Denturist.
Yeah, very good. Who is it answering actually? Your name? Very nice.
It's Dr. Deepak. Yeah.
Okay. A person called Dash influenced the dental nurse scheme.
Hunter.
Initial is also important, but very good.
Thomas.
T.A. Hunter. Yeah.
T.A. Hunter.
Yeah, very good. T.A. Hunter. The fifth one is the first school dental nurse model graduated in Britain in the year 1962 were called as Dash.
New Cross auxiliaries.
Very good. Then the sixth question, the four types of supervision are general, indirect, direct, and one more.
General.
Personal.
Huh? Yeah, personal. The seventh question, Mrs. Irene Newman was the first dental dash.
Dental hygienist.
Very good.
Hygienist.
So dash, someone is the father of dental hygiene.
Dr. Phones. Alfred Phones.
The full name is also again important. Alfred Cillian Phones. Okay. Technotherapists are commonly called as the other name for technotherapist.
Expanded function operator.
Expanded duty.
Dental auxiliary.
Expanded function duty.
Very good, very good.
Dental auxiliary.
And the two new type of dental auxiliaries which were given by WHO.
Dental aid and dental licensing.
Licensing.
Very good. So even if you haven't answered, it's okay. We all started from the scratch only. So keep guessing and keep trying. And all the best for all your examinations, maybe online or anything offline. All the best for everyone. And my sincere thanks to all my lovable teachers, Dr. Preeta Elizabeth Chali and Dr. Shyam Sivasamy. And my heartfelt thanks to Dr. Benzi also for this wonderful opportunity, sir. Thank you so much. And if there is any doubts, you can contact me. My mail ID is given. If you want anything also, any help also regarding anything, you can contact me. Thank you, sir.
All right. So I think that was a very, very interesting session by Dr. Divya. Made very interactive, very concise, encompassing all the main points which are required from an exam point of view, as well as covering up the details in this topic. So students, like we understand the evolution of dental auxiliaries, or even if you look at the broader aspect of manpower in dentistry, right? We must understand that even when it comes to the evaluation of various systems, okay, when you're having healthcare delivery systems functioning to the fullest of their abilities, you do need to focus on how quickly the job can be done, okay? Especially when you're targeting programs, in national health programs. It's not about a dentist performing a certain procedure, probably with the help of another auxiliary. So if you look at all of that, you'll see all that which was listed so far, right? In the 40 minutes of session. So we can notice that it is all based upon the job description and the titles, and how each one can maximize and bring about. So the concept of 400 dentistry is definitely economically very, very feasible, and then economically very viable. And that makes all the more sense for us to understand that the art and science and the business of dentistry. So this happens to be very important for us to know that there have been various attempts in this regard. And if you can see, there was a lot of trivia in today's session, from evolution of certain kind of auxiliaries, operating, non-operating. And you can find more about this in a couple of textbooks of public health, dental public health specifically. You can look it up in Slack and Dunning and Jongs. It's all there. And you will find a lot of these content are mainly so that you're able to perform the whole art of dentistry, in a way which minimizes the costs, again, which reduces the fatigue and division of work at the chair side. All right. So like they say, you are only as good as your team, right? If you look at any of the, wonderfully functioning dental clinics and chains and all of them, they're all actually backed by very, very efficient auxiliaries and operating. In fact, you walk in outside and see in clinics, or it can be multi-specialty setups. They have figured out their manpower allocation. They've understood who does what, and that brings out the organization objectives to the fullest. So think beyond just, an exam question, or maybe a short note, or just memorizing some terminologies for this. This is important for you in practice management as well, because only when you figure out these things, I think you should be able to understand the depth of this topic at large. So thank you so much, Dr. Divya. I think that was a splendid session from you. Quickly, I think if we can have any questions from the audience, please. Yeah, you might unmute yourself and ask a question, or you could also put that in the chat box. I think we have Dr. Manjunath Puranik, sir, who's joined us there. Good evening, sir.
Good evening, Dr. Tensi.
Good evening, sir.
Good evening.
Good evening. It was a very nice presentation, Dr. Divya.
Thank you so much, sir. Thank you so much.
Yeah, you have covered everything, almost everything in dental manpower. And
Thank
also
you.
you have inspired the young graduates to employ dental auxiliaries in their practice.
Yes, sir.
Very nice.
Thank you so much, sir. Thank you. Means a lot, sir. Thank you so much.
Yeah, thanks so much.
Thank you so much, Puranik sir.
Thank you.
From such a renowned teacher, I think sir is very familiar with how it should be presented. So thank you so much, sir, for your remarks. Okay, any of the students, if you have any of the PGs, in case if you're wondering, dental manpower also features in your fourth paper. It has also come as an essay question. I think there are a couple of PGs who are attending the session, so I'm just putting this across. You will have to go a little bit in detail and probably employ like a SWOT analysis, that how you would suggest, and also in your problem solving exercise, when you do the manner calculations and allocation, right? So you need to know the combinations. So please look up dental public health books for scenarios and for examples. We'll be again very happy to share with you all if you do write to us and reach us or any of our platforms, and we can really help you out in that direction. For the undergraduates, like I said, very, very popular main question. Again, short notes and short essays, because there's a lot of new terminologies and trivia related to that. Entrance exam point of view, like they say, like all of you all answered without even letting go of the abbreviations, right? The enter and Alfred C's phones and Irene Newman, all of that. So please do make sure that you look it up before you appear for your entrance examinations. All right. So quickly, I think I'd like to take this opportunity and thank Dr. Divya for doing this session for us. She's splendid as usual, and she believes in telling things in a very crisp and a very lucid fashion, which is clearly understood by our students very well. And it was a very interactive session for us. And we shall be sharing a presentation in our learning groups. I've posted the link to our learning groups in the chat box. Anybody who's new here from different, they can always join in our group and you'll receive intimations about our future webinars. And we also have our new Prime membership, which is you'll be getting access to exclusive content and dedicated mentors for undergraduates and postgraduates. So make the most out of it, guys. I think COVID situation, of course, learning has been different on more of an experience through the digital platform. But as long as concepts are being told in the way they are understood by students, I think that really fulfills the purpose of teachers and students on the whole. Thank you so much, Dr. Divya, for taking this time out and doing this for us. Any other questions or anything quickly? Otherwise, I'll ask Divya to just wrap this up and give us like a small crisp summary of today's session in a couple of minutes. Yes, Divya.
Shall I wait, sir, for someone to say, or shall
I think you can start with the summary. Meanwhile, if we have any questions, we'll address them.
Okay. So dental auxiliaries, as sir had already told, 400 dentistry should be promoted because we as such can't be doing all the procedures, all right from reception, receiving the patient till finishing the thing and then cleaning up the instruments is definitely not possible. That if you're a full-time clinician, it's not at all possible. So definitely 400 dentistry should be promoted. So in that case, if you see, auxiliaries are actually classified as two things. There is a non-operating auxiliaries and operating auxiliaries. They have given different designations for each kind of works the people are doing. So under non-operating, you have 4, and under operating, again, you have 4 different things. If you see the most important frequently asked question here, the dental surgery assistant is a very frequently asked question, and the EFDAs are again very frequently asked question. Apart from these 2 questions, in our university, they are more prone to ask Saskatchewan dental nurse. I don't know why why it's their favorite question, but they usually ask Saskatchewan dental nurse. So even that is again very important. Just don't learn anything regarding their duties alone. Just know how they evolved right from the history. Even if you read and see, it will be very interesting to know how all these things evolved. Okay. So even if you want any other notes or any other information about dental manpower for any PGs here, I'll be able to give you, because I prepared a separate notes for PGs, and for UGs, I've just made the entire presentation. So for the PGs, the dental manpower notes as such, whatever I collected from 5 different books, I have a note also. So if you want any PDF or if you want any Word document to be shared, even at that I'll be able to do. So on the whole, according to me, 400 dentistry should be promoted, because even in my clinic, I'm doing that thing only. So yeah, that's also.
So that was really lovely, Divya. I think thank you so much, all of you participants, for joining in, and please do reach out for us if you need any assistance in this topic, UGs and PGs alike. And all the very best for your examinations. I think some of the universities completed their PG exams, and we are having it this month and subsequent. So this is the time, again, challenging times. So make sure you don't miss out on the essential details and cover the syllabus comprehensively, and make sure you keep revising time again to make sure that you can perform really well in the examinations. We'll see you all soon next Wednesday for our next session, right? We'll be having a regular academic sessions every Wednesday. So we'll be having new teachers joining us, bringing their added experience, on the whole benefiting the students at large. Thank you so much, Dr. Divya Raghunathan, for taking time and doing this. And thank you, dear participants. Thank you.